Hello everyone, this is Preeti and you're watching my resolution. In this video, we'll be seeing one of the most important clinical feature, that is pallor, which will come across in various subjects like medicine, ortho, OBG, in everything. Wherever you do general physical examination, you will be coming across this pallor. Pallor is nothing but paleness of skin or mucous membrane, which is most commonly seen using both the hands. These are your eyes. This is lower palpable conjunctiva after you retract your lower eyelid. So using this is one hand, this is one hand. You will be using both the hands to show pallor, to see, look for the pallor. Then this pallor is due to decreased RBC count or hemoglobin in the blood. This hemoglobin will be carrying oxygen, so oxygen carrying capacity is also decreased, or due to decreased blood flow. There is a huge there is blood, sufficient blood, but still it is not flowing to that area, then we call it also as pallor. Normal HB level in males, it ranges from 13 to 17 grams per deciliter, whereas in females 12 to 15 grams per deciliter. Where you will check for pallor, that is lower palpebral conjunctiva. This is one of the site. First you will see this using both your hands and tongue. You will ask the patient to open his tongue or her tongue and look for pallor in the tongue. Then palmar's creases. In severe case of pallor, you can't see palmar creases. That white it will be, palms will be, and nail beds you can see. And grades of pallor, coming for the grades of pallor, we have mild, moderate, and severe. In mild, only you can see pallor in lower palpable conjunctiva involving blood hemoglobin levels 10 to 11 grams per deciliter in case of mild. Whereas in moderate, you'll see both pallor in both conjunctiva and as well as the tongue. Tongue is additional here, and hemoglobin levels corresponds to 7 to 10 grams per deciliter. Whereas in case of severe, that is early easily noticeable pallor, where you see above features, like that means lower palpable conjunctiva and tongue, palmar creases will disappear, and hemoglobin level corresponds to less than 7 grams per deciliter. This is where you call it as a severe pallor. Causes for pallor, it can be anemic causes, like all types of anemia, iron deficiency anemia, megaloblastic anemia, and hemolytic anemia. And peripheral vasoconstriction, I told that decreased blood flow is also is a cause of pallor. So peripheral vasoconstriction, cold exposure to cold, and shock. These cold exposure, this is one of the therapeutic use, where in case of epistasis, in the casualty and all, in epistasis, normal saline which is kept in the refrigerator will be used in this, it will be infused, which creates cold and vasoconstriction and decreases bleeding. That in case this is a therapeutic use of cold, which causes vasoconstriction, which also causes pallor, but that is therapeutic advantage. And in case of acute blood loss like a trauma or GI bleed, you'll see pallor. Local causes like Raynaud's phenomenon and